The topic of our final presentation is on patient portals by Catherine Ward, Kelsey Thigpen, and Kristen Mountford. Over the past many years, healthcare has been making huge transitions to promote patient and family-centered care, where the patient and family take greater control and engagement in their own health and healing. One development that has made this possible is the patient portal. A patient portal is defined as a web-based platform or mobile application that provides patients with the necessary tools to directly access, review, and monitor their electronic health records, which promotes greater involvement within one's health. Both the High-Tech Act's Meaningful Use Incentive Program and the later Medicare Access and CHIP Reauthorization Act promoted the expansion and adoption of patient portals, as this technology helped to fulfill the requirement for a patient-centric healthcare system and patient engagement in their own care. Patient portals provide increased accessibility to one's care providers, personal healthcare data all in a succinct location, and follow their own timeline of care. Portals are accessible 24 hours a day and 7 days a week, and the only requirements are internet access and access to a computer or smartphone. The purpose of the patient portal was to improve health data accessibility, self-management, care coordination, and reduction of healthcare costs. They were created with the expectation of improving patient outcomes. The more patients could take a greater role in managing and planning their care while being able to watch their progress, the better expected the outcome and prognosis. Patient portals have been found to be beneficial and are expected to greatly improve healthcare. However, the majority of the population continues to not use patient portals, despite its perceived usefulness. Some stated barriers and limitations for this reason include a lack of ease in its usability. They have too many passwords they already have to remember. There's a fear of security and privacy issues. There's the existent features that are unknown by patients and physicians. Insufficient time for physicians to teach patients about portals and to review the data that patients input, and computer and server problems that arise upon the initial setup. So what are the features and capabilities that a patient portal provides? Well, it allows patients to make appointments, request referrals, refill prescriptions, update insurance or contact information, make payments, fill out forms online, ask questions to providers, access educational materials, view summaries of their visits, results from tests, and immunization records, all in one succinct location. Some patient portals provide the capability of engaging in e-visits for minor non-emergent issues where diagnoses and treatments can be provided online.
So there were several key topics that came up in the literature review, and we're just going to go through. Some were good things about patient portals, some were bad. We're just going to go through it. So the first good is that there's better chronic condition management with patient portals. Patients are more informed of their health information, and that increased engagement can lead to better chronic condition management. Next is that patient portals provide better continuity of care and communication between providers. Providers can all see your medications, notes from other providers. It just gives them a better picture of your health as a whole. Also, patient portals help meet Healthy People 2020 goals. This first one under Health Information Technology 5.1 is to increase the proportion of persons who use the internet to keep track of their personal health information. And 5.2 is to increase the proportion of persons who use the internet to communicate with their health provider, both of things that patient portals provide. And it meets meaningful use goals. The ability of patients to be able to view their health information electronically meets the intent of that stage 2 requirement. And lastly, use is increasing internationally. This is not just happening in the United States. EHR functionality and patient portal use is increasing in many developed countries. But it's not all good. There are some bad. Some of the bad things that came up in this literature review is that there are disparities in portal use. For example, individuals who are racial, ethnic minorities, and persons from lower socioeconomic status are less likely to enroll and use patient portals than non-Hispanic white persons and persons with higher socioeconomic status. And lastly, increased user friendliness is needed, especially for those with low technology literacy. Some of these patient portals can be clunky and difficult to use, especially for the elderly.
The patient portal cannot address only a single population. Its purpose to improve health outcomes through increased patient involvement requires that portals accommodate for the various populations that will use it, including the elderly, the perinatal population, and the oncological populations. The number of U.S. individuals greater than or equal to 65 years old is growing, and healthcare must meet the needs of this quickly growing population that bears some of the greatest healthcare needs. Literature showed that the older adults' decision to use patient portals were influenced by their concern for lack of privacy and security of their health data, their lack of access to the internet or a computer, requirement to memorize another password, computer and internet illiteracy, and computer anxiety. Many portals were found to have small fonts, English-only text, content written at a high literacy level, and complex interfaces, making it difficult for the older or non-English speaking populations to use and maneuver. Some patient portals are beginning to include language accommodations in Spanish and Chinese, but there is yet to be accommodations for the vision impaired and mobility challenged individuals. The older adult population has provided suggestions to make their experience of patient portals more positive, including requests for voice commands, physical technical assistance and teaching on how to use the portals, the provision of a medical term dictionary, and encouragement of patient portal usage by their providers. Elderly patients also provided many recommendations for features that already existed in the portals, indicating they were not well educated about existing features and capabilities of this technology.
Another special population where portal use is really important is the perinatal population. The perinatal period, which is pregnancy, birth, and postpartum, is an important time for patients to be engaged in their health care. Authors Wieland et al. Note that active engagement during pregnancy can influence outcomes. These authors also note that the most appealing functions of patient portals are for patients to check their results and manage their appointments. This next group of authors, Forster et al., reported that pregnant patients use portals to review information before their appointments for preparation and after their appointments for review, to complete hospital registration, and as a way to access support tools, public health information, etc. So it's a really comprehensive tool for the perinatal population. However, this last group of authors, Kim, Matthews, etc., found that patients need provider motivation to use portals. A simple statement that patient portals exist, you can access it, is not enough. They need the providers to explain what their purpose is, to tell them that the provider themselves will use it to message them if the patient messages them first, and just a way to communicate about their care.
A third specialty population that has benefited from patient portals is outpatient oncology clinics. Patients in these settings are in constant need of treatment and communication with their providers and healthcare staff. Some key usage needs for the patient portal in the oncology setting include constant laboratory results and trends. Patients are constantly getting updated blood work, CT scans, MRIs, etc. Recurring treatment scheduling. Sometimes patients are on a schedule where they're coming to chemo or radiation once or several times a week. This could be beneficial to help keep them on track. Medication refills. Some patients are taking chemo as a pill form and may need a refill, but don't necessarily need to see their primary care or oncologist to do so. Some may need supplementary medications to counteract the effects of treatment, such as nausea and vomiting. Symptom development or changes. The portal could be used to inform the provider of any change of condition that may occur. Frequently asked questions. There's a lot unknown in this field of oncology, and constant questions and guidance may be needed. Lastly, support and encouragement. The patient portal could be used by the patient for resources that could be available for support groups, for information on their disease process, or for treatment options. There are many pros and cons to utilizing patient portals in practice. In today's age of technology, it can be fast and efficient to use in some populations, yet overwhelming and inconvenient to others. Here are some pros and cons to using patient portals. In the pros side, it does save time. You can message your provider for any advice and don't necessarily need to call to make an appointment. You can do so right on the patient portal. Laboratory and diagnostic testing can be provided straight to the patient. After you've gone in for a visit and have done lab work, it can be posted right to the patient portal. It caters to the specialty populations who need more communication with the provider. As mentioned earlier in the presentation, this applies to geriatrics, the OB, oncology, and any chronic diseases that patients may have, such as diabetes. It encourages patient participation in care. When a patient is constantly in communication with their healthcare provider and being held accountable, it allows them to be a strong participant in their healthcare. It's also a user-friendly design. With today's age of technology and iPhones and smartphones, we are all using applications. With the addition of a simple application to your smartphone, you can easily access all of your healthcare information in one place. Some cons include, from the nurse's perspective, sometimes inboxes are filling up with non-emergent cases or taking up patient care time in the clinics. If a nurse is spending time responding to the patient portal and not utilizing their time in their clinics with their patients who are actually there, it can be unnecessary. Sometimes patients use it for emergencies, and it doesn't always get checked right away. If they're having chest pain, or if they're having trouble breathing, and they're using the patient portal to call in and report this, sometimes it's not seen right away, and it may be too late for treatment. Technology is always difficult for older generations and low-income populations. Either they didn't grow up with a smartphone or a computer, or they don't have access to one. Usability. Technology could be difficult for some people who have not used applications before. They may interpret the data incorrectly or not at all. Patient awareness. They may not know that the portal is even available to them. I know oftentimes when I go to see the doctor, I don't know that the portal exists, and I miss important information on how to log on, therefore missing the opportunity to check my results later. There are many pros and cons to using patient portals depending on the person using it. Some people love it, and some people prefer just to get the traditional way of calling in and getting their results, or talking to the provider by making an appointment. Patient portals have become more and more important to the world of healthcare, especially for providers and healthcare workers. It is crucial to understand some of the requirements and goals for patient care and how patient portals influence this process of health promotion and disease prevention in various populations, especially from the provider's perspective. Some of these include: improves quality patient care. Patients feel cared for and important in their process of health. Provider ratings continually go up. Users have the ability to rank their providers, which can be seen through the portals by others. It keeps current with meaningful use core measures. Incentives are in place to stay on track with Stage 1 and Stage 2 requirements, as 50% of patients must have access to their electronic healthcare records. Home device monitoring. For example, blood glucose monitoring for a patient with diabetes. When they take their glucose, the levels get sent directly to the provider if dangerous trends or levels are noted. This leads to early intervention. Disease prevention. Providers can send reminder alerts, daily nutrition facts, etc., for encouraging healthy lifestyles to their patients. Patient education. The portal can provide educational resources and materials to their patients to read and understand some of the symptoms and disease processes. Lastly, the portals stay current with the evolution of technology. Younger generations are heavily relying on technology, and portals give them that opportunity to use their health right on their smartphone. As a conclusion, overall, patient portals are becoming increasingly more beneficial to patients. The applications are continuing to 1. Increase their patient involvement in their own health, 2. Increase patient trust and relationships with their providers, 3. Increase convenience, and 4. Decrease unnecessary costs and visits to both the provider as well as the patient. This concludes our presentation on patient portals. Thank you for listening. To follow, you will find our references as well as a list of contributions from each team member.